What should I know before my STI test? Getting ready for an STI test can feel a bit overwhelming, but knowing what to expect makes the process smoother and more effective. First, understand that STI testing is designed to detect infections like chlamydia, gonorrhea, syphilis, HIV, and others, often before symptoms show up. Early detection is key because it allows for prompt treatment and helps prevent spreading infections to others. Different infections requiring different tests, so your healthcare provider might take blood samples, urine, or swabs from your genital area, throat, or rectum depending on your sexual activity and exposure sites. For example, nucleic acid amplification tests are very sensitive and are commonly used for detecting chlamydia and gonorrhea. Sometimes, you might be asked to self-collect samples at home, but follow-up with your provider is important to review results and discuss next steps. Before your test, avoid urinating for at least 1 hour if you're providing a urine sample, as this can improve accuracy. Be honest with your healthcare provider about your sexual history, recent symptoms, and any concerns you have. Sharing this information helps them choose the right tests and interpret results correctly. Some tests may require you to refrain from sexual activity for a short period before testing to prevent false results. During the test, expect a quick, minimally invasive procedure. You might give a urine sample, have swabs taken from specific areas, or provide a blood sample. In some cases, testing can be done at home with self-collected samples, but always follow up with your healthcare provider for proper interpretation and care. Results usually take a few days to a week. If your results come back positive, your healthcare provider will discuss treatment options, which often include antibiotics or antiviral medications depending on the infection. They will also advise you to notify recent sexual partners so they can get tested and treated if necessary. Retesting after treatment is often recommended, especially for infections like chlamydia and gonorrhea, to confirm that the infection has been cleared. Rest assured, STI testing is confidential. Healthcare providers are trained to be respectful and non-judgmental, and your privacy is protected. Support and counseling are available if you need help understanding your results or planning your next steps. Remember, testing is an important part of maintaining your sexual health. It's not just about finding infections, but also about prevention. Using condoms consistently, reducing the number of sexual partners, getting vaccinated against preventable infections like hepatitis B and human papillomavirus, and discussing pre-exposure prophylaxis if at risk for HIV are all valuable strategies. Routine screening is especially recommended for sexually active individuals under 25, men who have sex with men, people with multiple partners, or those experiencing symptoms. Pregnant women are also routinely tested to protect both mother and baby. In summary, before your STI test, know which infections are being tested for, how samples will be collected, how to prepare, and the importance of honest communication with your healthcare provider. Testing is a routine, confidential part of sexual health care aimed at early detection, effective treatment, and prevention of infections. Always consult with a healthcare professional for personalized advice and follow their guidance for the best outcomes.